It's a new tool to help critically ill patients. Care EMS announcing it's now carrying whole blood on board ambulances. Patients suffering traumatic injuries can now receive blood transfusions. Channel 5's Monica de Anda is live in McAllen with the details. Monica.
We're outside Care EMS in McAllen, and these ambulances right here now have whole blood on hand that could provide potentially life-saving transfusions. Every time there's a medical emergency, paramedics and EMTs respond. And now they have a new tool to help them care for critically injured patients, whole blood.
Yes, before we were given normal saline, essentially it was just salt water. And it doesn't have the ability to carry nutrients or oxygen to the body's tissues, which it needs in a critical emergency when the patient's going towards shock.
Richard Becerra, clinical coordinator with Care EMS, says they respond to trauma-related calls daily. So having O-positive blood on board allows them to better care for patients who desperately need a transfusion.
This is what we use to transport the blood. This will actually keep the blood cold for 48 hours in the back of a hot vehicle.
Each pouch contains 1 unit of blood, with temperature checks happening every 30 seconds while it sits inside this mini freezer. And when a patient needs it,
we take the blood from 35 degrees Fahrenheit, warm it all the way up to 98.6 degrees body temperature, and within 10 seconds we have warm blood infusing into our patients.
Care EMS started carrying the blood in March, and since then they've done 4 successful field transfusions. And Becerra says they're able to use the blood on any patient without having to cross-match it.
It's definitely a huge confidence booster, being able to have more treatments for our patients, better treatments for our patients, and get them into a situation where we could potentially help them out a lot more.
So when they get their next call about a critically injured patient that's lost a lot of blood, they'll be more than ready. Again, these transfusions are already happening, and we're told that the blood is able to be used on anyone 5 years and older. Reporting in McAllen, Monica de Anda, Channel 5 News at 6.